Ebola is a rare and deadly disease caused by the Ebola virus. Ebola viruses are found in several African countries. It is important to know what to do to protect yourself if you travel to an area where there is an Ebola outbreak or come in direct contact with someone who has Ebola. Here are some actions you can take. Wash your hands often. Avoid contact with the body fluids of an infected person or any items that may have come in contact with an infected person's body fluids. These can include clothes, bedding, or medical equipment. Don't touch the body of someone who has died from Ebola. Avoid contact with animals such as bats or monkeys that may carry the Ebola virus. Don't eat wild animals hunted for food in Africa, also known as bushmeat. If you return from a country with an Ebola outbreak or are in contact with a person with Ebola, call your doctor and tell her or him about your recent travel or contact with a person with Ebola. Monitor your health for 21 days. Take your temperature twice a day. Watch for symptoms including fever, headache, stomach pain, diarrhea and vomiting, and bleeding or bruising. If you decide to visit the doctor's office or emergency room, call ahead before you go. Tell them about your possible exposure to Ebola. Basic care like IV fluids and treatment for other infections can help many Ebola patients recover. At this time, there are no approved vaccines or treatment for Ebola, but researchers are working to develop them. People who recover from Ebola may be immune to it for many years. However, some develop long-term problems such as joint and vision problems. Warning: even after recovery, Ebola might still be found in some body fluids, including semen, for many months. For current information on Ebola, visit the Centers for Disease Control and Prevention, the CDC website, at www.cdc.gov/VHF/Ebola or call the CDC info line at 1-800-CDC-INFO or 800-232-4636.